And now, it's my privilege to introduce our keynote speaker, Professor Maurício Barreto. Mauricio, will you please come to the stage? Mauricio is an Emeritus Professor at Universidade Federal da Bahia in Brazil and Senior Investigator at Fundação Oswaldo Cruz. His diverse research in epidemiology and collective health focuses on the social and environmental determinants of health, health inequalities, and the impact of social interventions on health. Currently, his major research program is around the 100 million Brazilian cohort investigating social and environmental determinants of health, particularly the impact of poverty reduction policies on health using the linkage of large administrative Brazilian databases. Mauricio is an elected fellow of the Brazilian Academy of Sciences and World Academy of Sciences, a member of the scientific committee advising the governor of Northeast region of Brazil, and a member of COVID-19 specialist group of the academic panel, the Global Network of Science Academies. He is an honorary professor at the London School of Hygiene and Tropical Medicine. During the COVID-19 pandemic, Mauricio founded and continues to coordinate the CoVida Network. I'm sure he will also give us tonight some inside intel on the Brazilian elections. So please join me in welcome Mauricio.
Okay, thank you very much, Dan. So thank you to the society for this invitation. Yeah, I would like to say that my English is not my mother tongue. Then I apologize for any mistake, but I will make all my efforts to be as clear as possible. I need a presentation, please. Yeah, when Dan called me to invite me and put to me the topic of this meeting, then I chose to talk on one subject, one area that I have been working for a long time about that I put in the topic, poverty, inequality, social justice, health, yeah. And as you see in my talk, I introduce the idea of democracy as central in this process of building healthy places and healthy countries. I've been working all my time in Brazil. Yeah, I was born in Brazil, working all my time in Brazil. Then Brazil is my focus. All my long trajectory as doctor, as an epidemiologist, have been to understand what's happened in terms of health in Brazil. Then I would like in this message here today to give some flavor of my finds and what I think about that. I'd like to introduce, put some assumption. First, the type of political system determines whether the government is yes or not work on behalf of people. The link between democracy and health is multidirectional and based in social justice. Democratic principles support health by focus attention on poverty, social inequality, human rights, and equity-oriented policies. Even though we believe in these assumptions and they are valid, there is limited evidence to sustain them. Then my aim here tonight is try to present and discuss evidence produced in Brazil of the interdependency and deep connection between democracy, poverty, inequality, social justice, human rights, and health. To give you a few facts, not all of you know about Brazil, then I put some quick facts, Brazil is a large country with 8.5 million square kilometers in South America, a population of over 200 million people, colonized by Portuguese from 1500, gained independence in 1822, and become a republic in 1889. Tradition of authoritarian government, alternated with democratic periods, And then in recent time, I would like to call the attention, because some of these I'm going to discuss in my presentation, that from 1964 to 1985, you have a military dictatorship. In 85, a democratic period, we start a democratic period, that was very, very progressive, yeah, and where a lot of equitable social and health policies, yeah, were presented for the society and implemented in Brazil. This until 2015, yeah, where there was a institutional coup, yeah, it's a modern type of a change government, yeah, with impeachment of the first woman elected president, causing a breach in democracy and the demolition of the equitable social and health policy. Then my plan to present to you, I'm a fan of theater, then I'm going to present in 3 acts in an epilogue, yeah. The first act, yeah, is from very large period, yeah, from the colonial period to the end of the military dictatorship. The second act that I will go deeply, yeah, is the rebuilding of democracy and the establishment of equitable social and health policies that go over 30 years, yeah, for 85 to 2015. The third act is 2015 until today, yeah, because I'm going to talk later. Today is a very important day in Brazil. And the epilogue, yeah, with some lessons learned from this, yeah. Then the first act, yeah, is from the colonial period of the military dictatorship. It was the period, yeah, that the wave of the fabric of an equal and unfair society. Nah? Brazil was, when the colonizers in 1500 arrived in Brazil, Brazil was a beautiful country, large country, nah? And the inhabitants were indigenous people, nah, that live. It's estimated that at least 3 million indigenous people lived in the territory of Brazil at that time. And then, during the process of colonization, the indigenous suffered a huge genocide, yeah? Diseases, yeah, different kind of diseases. Some of them that the colonizers took from Europe to South America, nah? Enslavement, massacres, yeah, and the other things. And nowadays, the indigenous population is less than 1 million people. Right? After all this time, yeah, decreased a lot, yeah, and living under the continuous threat of land invasion. Yeah, a lot of them yet live in territories, but under continuous threat of land invasion, increasing mineral exploration, deforestation, and forest fires, and escalating land insecurity and violence. Yeah. The second important component in our history is the enslaved people that coming from Africa to Brazil. To have an idea, around 5 million enslaved people come from Africa to Brazil. This is 8 to 10 times higher than the African that came to the United States, for example. Nah? And it's estimated that at least 1 million died during the transit, yeah, between Africa and Brazil. By 1850, yeah, the trafficking of enslaved humans have been abolished. In 1888, the slavery was abolished in Brazil. Nonetheless, these people were freed without land, without house, without education, without jobs, or any basic human rights. Then what you have in the picture, Brazil is a very black population, with now over 50% of the population is black. Yeah, and the indigenous population is very small. Now, when you compare with other Latin American countries, yeah, Brazil have a very small, near 0.5% of the population yet indigenous people. There was a huge effort from historians, sociologists, yeah, to understand this process that generates and operates the fabric of injustice and inequality. I'm not going to enter in this detail, but there is a vast literature and a vast effort to understand the mechanism. But what is important to us is that poverty and social inequality throughout history have always manifested as poor health and health inequality. And then what you have today, in the present time, you see the map of the world, the different countries, and the G9 index. G9 index is a measure of social inequality. You see Brazil is a very high G9 index, comparable with some other countries, but very high, which is the picture that you see below represented as the level of inequality that yet exists in the country. And to finish this act, after over 5 centuries, recently you publish a paper that show that the infant mortality in Brazil is relatively low in the mean population, but in the indigenous group is near 2.5 to 3 times higher than the general population. Among the black is the headline, is yet high, is higher than the other groups of the society. And when you see more details, this data coming from what you call 100 million cohort, that I'm going to talk later, the children from indigenous mothers have 6 times higher risk of death from malnutrition, 14 times higher risk of death from diarrhea, and 6.5 higher risk of death from lower respiratory infection. Children of black mothers have a better situation, but yet near 2 times higher decrease of chance of survival compared with the whites in the population. Then I go to the second act. That is a moment that I'd like to go because it more deeply, the 85 to 2015, that is the rebuilding of our democracy. It was an extremely important period. And the more important was a moment that a lot of equitable social and health policies was implemented in the country. Then in this moment, a new constitution was negotiated. And this constitution, for example, put health as a right for all Brazilians and the adult of the state. Then I think it's one of the few countries that put health as a right in the constitution. Then you have this, health for us is a constitutional right. Based on that, a lot of policies on the constitution were implemented in affirmative action policies, law of quotas for higher education, statute of the racial equality, and a lot of programs have been developed. You have a health system that you call SUS, that is a national health system, and a lot of interesting programs focus on specific groups like indigenous, black, and I'd like to highlight 2 specific programs that I'm going to talk more in details about them. That is a cash transfer program, and a family health program, or a comprehensive primary health care program. These I'm going to go in details to show the effect that it has on the health of the population. Then all this process of the democratic period generate a picture like this. You look on the 1991, this is the Human Development Index. In Brazil, we estimate this HDI at municipal level. In 1991 was very low. Brazil was red. In 20 years, you see a huge change in this picture. How this was a consequence of a lot of action and a lot of activity that give people access and the other actions that I'm going to talk later. The G9 index is yet high at the time, but in few years, they come down 10 points. Brazil had a G9 index of 0.6 and go to around 0.5 in this period. And I show also the reduction in social inequality in a relatively short period of time. In 2011, I was in a group that wrote this Lancet series on health in Brazil. You show here some of this picture in terms of health effect. One of the graphs is undernutrition. You see the red one in 1974. The situation in Brazil have a very high level of undernutrition. As years was coming, you see even in the poorest group, that is the group 1 in this graph, there was a huge decrease in child undernutrition. Show how this program was working. The graph on the right shows the reduction in infant mortality. Between 16 and 18, the decrease was very small, and Brazil was on outside in terms of the economic development of Brazil and the level of infant mortality at that time. You see, after 8, there was a sharp decrease in the infant mortality, and in very few years, infant mortality decreased a lot. Yeah, talking about infectious disease, specifically infectious disease, is one of the chapters of this series. You have there was a huge decrease in mortality in general for infectious disease. Yeah, and also you try to understand the different group of disease and how they stay in terms of the control, the advancement in control. Then you classify the groups in successful control. You see vaccine-preventable disease, diarrhea, Chagas disease, and partially successful control, HIV, AIDS, hepatitis, leprosy, TB, schistolaria. These are groups that have a huge advance and group that was not so advanced, and you try to understand that. And the success was a lot linked, the success of public policies. For example, the immunization program in Brazil have a huge success in control all the preventable, vaccine-preventable disease in childhood. Brazil produced vaccine, have a huge network of distribution. People accepted, at the time, accepted vaccine, the coverage was near 100%. These policies have proved to be quite efficient, despite sometimes being delayed or incomplete in some of them. Such policies have dealt with key determinants. Then you have policy in water supply, basic sanitation, vector elimination. Have provided access to preventive resources such as vaccine or expanded primary health care, extending access to basic health services. That one that have partially success, more complex diseases, that despite this advance, that have some effect on the disease, but they are chronic diseases like TB, need long infection, have long infection period, need, for example, the treatment for long time and the adherence to treatment. A lot of the diseases have long-term treatment. And then some have not good treatments or have some need some technological scientific development. And then the group showed that the partial success, those groups with partial success need policies, but also need scientific development to complement the gaps that exist in terms of the success. Then I'm going to present to you some evidence of my group for a lot of years. You have been evaluated 2 big programs in Brazil, the Family Health Program and the Bolsa Familia program, that is the cash transfer. I would like to talk in great details of some of our findings and some of the evidence that exists. The Family Health Program, you see here, starting around 2000, and very quickly increase the coverage, and is a very effective measure, in terms of goal, until those who need, in the periphery of the great cities or in rural areas, this group, this team of family health program, give access, opportunity of continuous access for different groups of the population. And the Bolsa Familia is a cash transfer program, also created in 2004, And cash transfer is a common type of program in different parts of the world, and it consists of some money that is transferred by the government to the family, in general for the woman of the family, this is very important, and you also quickly increase the coverage, and all those who need that have access to that. And then I'm going to present here some effect of these two programs, yeah? And then I divide my studies in two moments. One that I call the first generation of studies, that you use longitudinal ecological studies, these who are epidemiologists are very familiar, a mixed ecological studies using aggregated data from the over 5,000 Brazilian municipalities. And you have a very important, start to show important things. For example, the family health program, have impact on infant mortality, decreased by 22% the infant mortality. Have impact on postneonatal mortality by 31%. Decreasing the mortality by diarrhea, for diarrhea by 39%, or impact for decrease under 5 mortality by the order of 20%. Even NCDs, like cardiovascular and cerebrovascular, are affected by this program. You see here the cerebrovascular mortality decreased by 31% associated with the program. In the heart disease mortality by 36%. And even it was possible to decrease the gaps, the racial gaps. You see, it continue to exist if you see the graph that is in the paper, but the program, you show that the program have a equity, oriented action, capable to reduce the gap between blacks and no-blacks in the population. Another analysis was the Bolsa Familia program. This paper, for example, was published in 2013 that show impact of this program also in infant mortality, and on diarrhea mortality, on malnutrition, and on low respiratory infection mortality in children. Then a broad effect for a program that acts on poverty, indirectly on poverty. Later, a lot of studies were conducted using the same approach for different outcomes, like malaria, leprosy, tuberculosis, suicide, and the other things, and also some effect. There was no problem, healthy problem, that was not affected by the cash transfer program implemented in Brazil. But now I can talk about a second generation of studies. Who knows ecological study? They have a lot of methodological limitation, and you cannot look in some details necessary, for example, for policy implementation or other decision that need a more detailed knowledge. Then the second generation of studies is I call longitudinal individual-based study. You use a quasi-experimental, use the 100 million Brazilian cohort. We were very lucky that after this first generation of studies, it was possible to build in Salvador a center called cidacs, Center for Data and Knowledge Integration for Health. This center assembled data from different sources in Brazil, the register in Brazil. In general, you have a very nice register, in different things, and it was possible with this data to build what you call the 100 million Brazilian cohort. That in fact now, because it's a dynamic cohort, have 131 million people registered in this cohort. Then give you a huge possibility of investigation. You can see that there is a lot of things produced from this cohort, but one of the original focus was to evaluate this program, the Bolsa Familia and the Family Health Program. Here you have some of the studies already done, with this, because the cidacs was start to work in the end of 2016, and then the first papers start to come out 3 years later, because a lot of work to assemble this data, but now it's coming very strong and very nice results. Then in this, again, you have produced what you did using the ecological approach, using this individual-based longitudinal study, and you see here that the impact on under 5 mortality was of the order of 70%, But the better thing is that it was possible to evaluate and to stratify the population to see the effects in different subgroups of population. The cohort is very big, then you can stratify. You don't have one problem that the research normally does, that is the sample size constraint. You don't have this, you can do a lot of analysis, a stratified analysis. Then here you have some of these effects, For example, black mothers, the effect is higher, On the poor municipality, the impact is higher than the rich ones. There was studies on leprosy, show the effect on leprosy. There is studies on the impact on leprosy treatment, adherence and cure, You see here, increase the adherence of treatment by 22%, and the cure rate by 26%. Even in suicide, this it was very, very strong results because it showed a reduction of the order of 55%, in the rate of suicide among the recipient of Bolsa Família. Then the family health program is the same thing. It was a second generation of studies on the family health program that you started later, but you already some results, in printed results or in publication, like this one, show an impact on tuberculosis. Tuberculosis incidence, tuberculosis mortality, and tuberculosis fatality rate, And a very interesting study that is finalized, is now in paper preparation, show the impact on under 5 mortality for the order of 41%. Then came the third act, the undermining of democracy and demolition of equitable social and health policy. In 2015 was a very sad moment for the country that started a huge change in the policies, and some clear undermining of democracy and the equity-oriented policy that was oriented government at that time, You see here, first measure of this new approach was austerity measure. That is very common in some political option, to put austerity measure, and this means that the poor, the more vulnerable, will suffer with this kind of policy. You see here in this paper that you published a few years ago, the impact, of the cuts, that happen in different kind of policies. Everything directed to equity-oriented was cut. Was a conception, ideological conception of the government, not to be found, not to be sympathetic, with the idea of equity, and they cut, all the programs, great part of the program, you see in the last column, the level of reduction on great part of the equity-oriented policies that was come then. Then immediately happened. It was very automatic, The poverty that was decreasing very quickly and sharply started to increase again. The effect on health is very clear. Different studies show impact on of this austerity policy. The moment that this policy started to be implemented, change the curve of suicides, for example, homicide rates. There was a huge program in Brazil to control through stimulating no smoking and decreasing obesity, eating fruit and vegetables, and the other action that was very successful until around 2014. But you see, after 2015, there was a clear stimulation of these activities, and the decrease in this period, or the improvement in terms of behavior, in the positive behaviors for control, NCDs have been decreased a lot. And this study is very interesting, because as Brazil is big, there is different states and municipalities. This study basically shows that the municipality that resisted, and keep some level of protection and some level of investment in the policy, despite the federal government don't stimulate that, this group are protected in some way. These places are protected in some way. This is a very interesting find, because it shows that even in federal austerity policies, it is heterogeneous, and part of this heterogeneity is defined by places that keep running positive policies. In 2015-16, Brazil was having a huge epidemic of Zika, and again, the black mothers have 50% higher risk of congenital Zika syndrome. In 19, you have COVID-19. Again, Brazil is a champion in terms of mortality by COVID, and is higher than the United States. There is a negationist government, that don't have interest in treatment. And again, the mortality, the risk of death was 58 higher in the black population. And last but not least, the deforestation of Amazon. I think this is a question on planetary health. You see this curve is very clear to show that after years of policy decreasing the deforestation, it starts to grow again around 2015, 2016. There is an ascendant curve, that this other graph in the right side showing more details, a specific months of April. And you see to 22 in the months of April, and compare with the same months years before. Because there is a clear trend to deforestation of the Amazon. But what lesson have been learned from this? First, that since the colonial period, interdependent social and economic factors have generated an unfair and unequal society. During the 80s, with the democratization and a new constitution that laid the ground for several fundamental rights, a new political cycle started, rooted in democracy, freedom, and social justice principles. A virtuous interaction between no-health and health policies, implemented in a pro-equity perspective, had an immediate effect on poverty and social inequality, followed by a measurable impact on health and health inequality that I tried to show you. The recent breakdown on the democratic process in 2015 with austerity measures and cuts in social and health policy with strong equity and human rights component had immediate effects on the population health, reversing the downward trends, particularly in the most vulnerable group, Black, indigenous, poor, children, etc. Today is a great day in Brazil. The country who decided what to continue. Down the dark part, it chose 6 years ago, leading toward the reduction of democracy and dismantling of inclusive policy, or return to the path of democracy and pro-equity policies. And as I give the slide before the result of the election, the result was 2 hours ago, I prepared two ends for this, But hopefully, and thankfully, the Brazilian people with great discernment just elect a president that gives hope. Not only a president, is an ample front of democratic movements in the country, that give hope for a new democratic cycle with great hope that inclusive, pro-equity, and pro-environmental policies will be revived and strengthened. In that a new period of improvement in the health of the population will begin. Sadly, this do not happen. Then I'm going to delete it from my memories, okay? Then thank you very much for giving my time.